All right, we are people who keep our promises, and yes, we promised you we're going to have that great discussion about all sorts of cancer, and most importantly, women folk, cervical cancer, big issue, and in this country we have, that discussion. We have discussions about cancer and all manner of cancers. An important conversation, and we have Dr. Ari here. Actually, just my concern, generally, before you continue with
I was just waiting for you to at least pose a question, because, there's so many people dying of prostate and all kinds of cancers in Kenya.
Yes. And my question is, that with all these regards to, new technologies and new institutions or places where people, can not only first detect cancer at early stage, this country, we've not invested so much for everyone, the people who don't have who are not employed, the poor in our society and all that. We have these great things for some of us, who have resources, but most of us do not have access to this.
That is indeed very true. There are many advances that have been made in detecting cancers quite early. Unfortunately, the diagnosis, the treatment of cancer is extremely expensive. And as you rightfully put it, currently, it's those who can afford it that are receiving the best treatment. Unfortunately, we don't have all these diagnostic modalities and the treatment modalities spread out evenly around Kenya, which is really sad. But at least we are seeing there's an effort being made to get these things out there. Though slow, but at least there's an effort.
Right. All right. Now, knowing that we are talking about cancers, and I'm sure there's a whole lot as well that we are going to talk about, but I would like us to briefly also bring in the issue of fibrosis. We are seeing an increased number of people, or younger people especially, even below the ages of 30, who are getting fibroids. What is the major cause of fibroids? Is there like a common cause for this? And what are some of the signs and symptoms that can be detected, and so it can be treated early and on time?
Okay, to begin with, I would like to explain what really fibroids are. These are non-cancerous growths that occur within the wall of the womb or the uterus, so to speak. As I said, they are non-cancerous, and so most of them usually would not cause as much morbidity, but they can be symptomatic, and some of the symptoms that they can present with, especially if they're very large, is excessive bleeding during the monthly periods, infertility, because if they're very large, then they block the implantation of a fetus. So you find women with very large fibroids would suffer from infertility. As I said earlier, the bleeding can be so marked that the blood levels of the woman get so low that they actually need transfusion. You asked me about the causes. Now, most uterine fibroids, actually you will find there is a hereditary bit to it. You find if your mother or your sister, a first-degree female relative, has had uterine fibroids, then one is at a higher risk of also developing fibroids. Fibroids are usually under the effect of estrogen, which is usually a hormone produced in the ovary. So you find women who have started their monthly periods at an earlier age, earlier than 12, tend to be at a higher risk of developing uterine fibroids. Also, women who have not been pregnant have actually a higher risk also of getting fibroids. Now, as I had said, they are non-cancerous, so if they are not too large and they do not cause any symptoms, then there is what we call watchful waiting. You can just leave them well enough. If they're extremely symptomatic, then surgery can be done, and the surgeries vary from actually just taking out the fibroids themselves or taking out the whole uterus, especially if this is a woman who's has fulfilled her family size, does not want any more children. For women who've not yet had their children and they would like more, there are certain drugs that can be given to shrink the fibroids. Mostly women who are about to be menopausal, we actually advise them to just leave the fibroids if the symptoms are not too bad, because after menopause, when the estrogen levels go down, these fibroids tend to shrink
They
by
shrink on their
themselves.
own.
Yes.
All right. You talked about women who haven't given birth yet. What would you say is the prime age for women to start giving birth? So, or is it even better to start giving birth earlier so that they can avoid fibroids or anything like that?
It's funny
Is
you
there
should
a prime age?
It's funny you should ask that because one of the risk factors of, for example, breast cancer, or one of the risk factors of ovarian cancer is not being pregnant or having children after the age, first pregnancy after the age of 30. So ideally, the best age, the ideal age to actually have, to have children would be in the 20s.
Okay, and now let's talk about ovarian cancer and cervical cancer. These are two different cancers, if I might get that correct from you. What is the difference between these two cancers, and what are some of the signs and symptoms of cervical cancer, for instance, and ovarian cancer?
Right, I'll start probably first by explaining what each of those organs are. The ovary is a paired organ. We have two, every woman has two ovaries on either sides of the uterus. And what the ovaries do is to produce an egg every single month. This is the egg that would actually be fertilized by a spermatozoa to create the fetus. On the other hand, the cervix is the opening to the uterus, the opening to the womb, and it opens out into the vagina. So I'll start with the symptoms of ovarian cancer. Unfortunately, most patients will not experience symptoms in its early stage. As I said, the ovary is on, we have two ovaries on both sides of the uterus, which is in the pelvis, and most patients will come to us when it's it's advanced, it's at its advanced stages, because the symptoms are very shall I say, mild, or can be confused for other issues. So the commonest thing would be bloatedness, an abnormal increase in the belly size, the abdomen, irregular bleeding during the monthly periods, and basically just change in what we call bowel habits, constipation, diarrhea, constipation, just irregular bowel habits. Now, the cervix, on the other hand, cervical cancer currently is known. Most of them are caused by infection by human papilloma virus. Most of the symptoms include foul-smelling pervaginal discharge, pain during sexual intercourse, abnormal bleeding, again, pelvic pain, unexplained pelvic pain.
Right. And how can we best treat these cancers? Because most of them, and knowing that some of the symptoms are normally overlooked by people who are infected with these cancers, how best can we treat ovarian cancer? How best can we treat cervical cancer? And even just how can we know that, look, this is the right time for me to go to hospital and have myself checked? Because most people, knowing that you say that you get most of these patients in the advanced stages of these cancers, what measures can people take up to be able to detect these cancers on time and have them treated, and what is the best treatment for them?
Okay, prevention is usually best, and we advocate for women after sexual debut or after the age of 21 to keep going for what we call a pap smear. A pap smear basically just means your gynecologist takes a bit of a scraping from the cervical surface, which is then given to a pathologist who looks at these cells under the microscope and can catch early signs of changes in those cells that could indicate that you're heading towards developing a cancer. So we are advocating for all women, as long as you're sexually active, above the age of 21, regular pap smears could actually help. If one was to develop cancer, would actually be able to catch that in its pre-cancerous stage. For ovarian cancers, unfortunately, there is no hard and fast screening, what we call a screening test. But what we do say is most of these cancers run in families. There are things we call risk factors. And for example, ovarian cancer, one of the risk factors is if any of your first-degree female relatives, that's a mother, a sister, or a daughter, has had ovarian cancer, then it means you're at a higher risk of developing ovarian cancer. And that should make you keep going regularly for checkups by your gynecologist. Smoking, alcohol, obesity, not ever having been pregnant. These are some of the risk factors that if you know you have any of this, you would be advised to keep having regular checkups with your gynecologist.
Right. And when you talk about regular checks with a gynecologist, can these cancers be prevented at all? And if yes, how can people prevent, for instance, cervical cancer? What do they need to stay away from? Because, for instance, I'll give an example of people with fibroids. Sometimes they're told to stay away from certain foods, stay away from all kinds of things, or stay away from, certain medications and all supplements. In the case of ovarian and cervical cancer, how can it be prevented if it can?
Okay, unfortunately, quite a number of these cancer cases, as I had said, are hereditary, meaning that their genes one has inherited from their parent. And unfortunately, for such cases, really, it's already encoded in your DNA. But we know there are risk factors like diet, foods rich in fat. We are encouraging people to take more fresh vegetables and fruits with lots of antioxidants. Smoking, we know smoking has been associated with each and every cancer.
Right.
Alcohol. I talked about human papilloma virus, which is the major cause of majority of the cervical cancers. Currently, there is a HPV, human papilloma virus vaccine that is being administered to young girls before their sexual debut. That is a preventive measure. And we also know that these HPV infections are usually sexually transmitted. So you find women with many sexual partners would be at a higher risk of contracting the human papilloma virus strains that do cause cervical cancer. So these are some of the things that can actually, use of protective measures like condoms. Yeah.
And what kind of treatment do we give people suffering from ovarian, cervical, or uterine cancer and any other cancers that have to do with the genitalia? Is there a specific treatment for them? And some people are saying they're actually taking ARVs in place for treatment for some of these cancers, and there's some of them who are already on ARVs. Is it even advisable for them to add on to that more treatment for these cancers?
Okay, I'll answer the question about the ARVs. There are cancers currently we know are associated with HIV. We know HIV usually lowers one's immunity, putting them at risk, for example, of HPV infection. So you will find that the ART treatment is not basically treating the cancer, but is being used to boost the immunity of this patient who has HIV and is currently having a cancer. The ARVs just boost the immunity, but is not the cure for the cancer.
Right.
Now, you asked what are the treatment options. For most of these cancers, whether ovary, cervix, or uterine, if it's caught at an early stage, it can be completely cured. Surgery, we could either take out the ovaries or the uterus and the cervix, or all three: cervix, uterus, ovary, and fallopian tubes, together with chemotherapy and radiotherapy. Sometimes you find the disease is so advanced, it's spread all over the belly, it's in the bones. So for such patients, it's basically more of palliative treatment, pain management, and maybe just a bit of radiotherapy or chemotherapy to try and shrink the tumor to, reduce what we call like pressure symptoms if the growth is too large and it's pressing on one of the other organs in the body.
All right. Somebody is saying, I got fibroids when I was 20 years old, and now she is 32, and she's not yet had them operated on. But what she's scared of is that when she gets operated on, her entire uterus is going to be taken out, and she has not had any children as per now. What options can she explore?
Okay. First, I would like to ask her, how symptomatic are these fibroids? Is she bleeding too much? Is there too much pain? If not, chances are she would need to see her gynecologist, who might advise her to take what we call gonadotrophin releasing hormone analogs, which help shrink the fibroids. But unfortunately, if they're extremely large, she's bleeding excessively to an extent that she may need transfusion. Unfortunately, the only option would be to have them removed. Not the whole uterus. There's a procedure called a myomectomy. But it's something she actually has to sit and discuss with her gynecologist. They have to assess how bad the symptoms are, how large the fibroids are. But if they're not that symptomatic, they're not too large, then the medication to shrink them would be the best way to go for her, especially because she's hoping to have children.
Right. And we also have one here who is saying, well, this is Abel Momani, who is asking, is cancer transmitted, for instance, prostate cancer in men to women?
No, cancer is not transmitted. It's not contagious.
All right, if it's not contagious, now, are there foods or specific foods, like you said, natural foods, that would keep the levels of getting cancer down? And if there are any, what are some of those foods?
As I had said earlier, we always advocate for plenty of fresh fruit and vegetables, because we know, it is a known fact that fruits and vegetables do have abundant antioxidants, which are actually cancer-fighting products.
Okay. We're speaking to Dr. Muthoni Kirimi, who is from Lancet Pathologists Kenya, and she's here to speak to us about the different cancers, especially those of them that affect women. And someone here is saying, thank you for enlightening the society about cervical cancer. It's worth sharing information. Now, I'm sure you do get a lot of patients who come to you, especially when their cancers are in advanced stages, breast cancer, cervical cancer, ovarian, uterine cancer, and all these tumors that people have, and they come in advanced stages. But we're also seeing a problem that maybe health facilities or medication is not that affordable in the country. So what is your advice to women out there, or Kenyans generally, in regarding to having them checked or having the pap smear, for instance, taken?
To begin with, a pap smear is one of the cheapest tests, and it is a test that can save lives. We have seen very many cases where, we've seen changes in those cells way early and have saved very many women from progressing to full-blown cancer. It's, as I said, it's a cheap test. It can be done anywhere. It doesn't involve theater. It's something that's actually just done in an office setup. And I believe you can get a pap smear done at any health facility, government or private. So I do not think that that should be an excuse that it's unavailable. Pap smears are available. They can be done all over. Granted, the other diagnostic tests might be, might only be found in high-end hospitals, but I believe even just going in for a medical examination by a gynecologist, a regular medical examination, who on examining you will tell you whether you actually really require this further test, is very important.
How often do you recommend that people should get checked for any of the cancers that they might be having without actually knowing?
For cervical cancers, we advocate at least a pap smear every year. For breast cancer, women above 40, we advocate for mammograms at least every 2 years. For ovarian cancer, as I said, we don't yet have very good screening tools, but if you have a risk factor, ideally you should see your gynecologist every other 2 years for, a general checkup.
And what would you say are some of the challenges you face as medics in Kenya at the moment in regard to treating cancer?
Cancer medication is extremely expensive. As I had said earlier, other than tests like pap smears, which are not that expensive, can be done anywhere, there are other tests we call tumor markers that may not be possible to be performed everywhere. There are specific places that these tumor markers can be done. So the expense of diagnosing, monitoring, and the medication itself, radiotherapy currently is only done in very selected areas, all in Nairobi. You cannot have radiotherapy done anywhere else outside of Nairobi. So those are some of the limitations we have as to the treatment.
Great. And what would be your final remarks to all the ladies out there who are watching the show at the moment, and those of them who would like to have access to affordable medication but cannot have it?
My advice to all women is to take control of their health. There are very many screening tests out there, and one of them, as I said, for breast, there's mammograms. For cervical cancer, there's pap smear. You need to take control of your health. Keep regularly having checkups. Keep visiting your gynecologist, not just when you have symptoms. I think that is another problem we tend to have. We only go when we do have symptoms, when there's excessive bleeding or when the pain is too much. I think we should get into the idea of actually going for regular checkups, for regular screening, if it's the mammograms, if it's the pap smears. That would be my advice to women. We can pick very early stages of cancer if one keeps going in for checkups and screening.
Some say they have a fear for visiting gynecologists, for instance, and that fear is just about not just the rural women, it's even with the urban. In fact, the urban are more afraid to go for these checkups as compared to the rural women. With the rural women, it's just that they don't have access to the health facilities. But here, where we have the health facilities, there's the phobia of going to see a gynecologist.
I don't know where the phobia comes from, but I think ideally when you get a gynecologist you're comfortable with, I don't think that should be much of a problem.
All right, there's someone who is saying she's 35 years old, she's a virgin. Okay, this is interesting. She's 35 years old, she's a virgin, and she's never gone to see a gynecologist, if I got that right. And she's wondering, is she at risk at all, knowing that she's not given birth?
As I had said, for cancers like for the breast and the ovary, one of the risk factors is having a fast pregnancy after the age of 30. That said, it does not mean that everyone who's had a child after the age of 30 would get breast cancer. It's just a risk factor that puts you at a higher risk of getting breast cancer than those who've had their children, their first children after the age or before the age of 30. As a woman of 35 years of age, I believe you should have started your yearly checkups, whether it's a pap smear, whether it's your breast examination. So yes, I believe you should start your examinations, your checkups.
Okay, and I guess we've come to close of this conversation. I hope, ladies especially, you've learned something, and it's important for you to always go for regular checkups. You just never know what kind of condition you might be having, or even cancer that you might be having. And there's so many questions that are coming through, but we'll be able to forward them to Dr. Muthoni Kirimi, and she'll be able to send us feedback, and hopefully we can forward it to you as well. Well, I would say there's so many. Well, I just wish I could read all of them, but then I cannot go through all of them. Someone is saying, what happens when after the age of 45 and I've hit menopause, I find out that I have fibroids? Is it advised for me to take out my uterus? But, well, we'll just forward all these questions to Dr. Kirimi, and she'll be able to give us feedback on that. Thank you so much for coming by. We do appreciate.
Thank you for having me.
And Dr. Kirimi is an atomic doctor. That is a hard one. And, well, we'll take a break now, and we'll be back to look at some of your feedback before winding up the show. Just stay with us.